Understanding the most common childhood illness and prevention tips will help parents and caregivers safeguard their children and raise them to be healthy and happy. Childhood is a wonderful time in life, but it also has its own set of health challenges. Children's immune systems are still developing, leaving them more vulnerable to sickness. In this video, we will discuss some of the most common childhood illness and practical prevention method any parent can use. Let us look at how you can keep your youngster safe and healthy. First, the most common illness in children and how to prevent them. Children frequently contract ailments such as cold and common, flu due to viral infection, ear infections, especially in toddlers, strep throat, a bacterial infection that occurs in school-age children. Conjunctivitis, also known as a pink eye, is a highly contagious eye ailment. Rotavirus or norovirus commonly causes stomach flu known as skin infection include impetigo and eczema flare-ups. Now the prevention tips: maintain proper hygiene including regular hand washing. Teach youngster not to share personal belongings such as towel or utensil. To strengthen your child's immunity, ensure that they get enough rest and eat a well-balanced diet. How to naturally prevent cold and flu in children? Second, how to naturally prevent cold in children. For this, if the cold and flu are among the most prevalent childhood illness, particularly during seasonal changes. Prevention strategies: encourage hand washing, teach kids to wash their hand after playing, before eating and after sneezing or coughing. Increase immunity naturally. Include fruits high in vitamin C such as oranges and kiwis in their diet. Throughout the winter, you can serve warm soup to provide additional nourishment. Avoid crowded places. During peak flu season, limit your exposure to large group. Teach coughing etiquette. Encourage your youngster to cough into an elbow or tissue. Third, how to improve children's immunity to prevent infections. A healthy immune system is essential for disease prevention. Key tips to strengthen immunity: nutritious fast. Eat plenty of leafy greens, almonds, yogurt and lean meats. Regular physical activity. Encourage your youngster to be active through play, sports or simple exercises. Adequate sleep. Sleep is necessary for immune system function. Set up a consistent bedtime regimen. Probiotics. Yogurt and probiotic pills can help you maintain excellent gut health. Fourth, teaching kids hygiene habit to prevent illness. Good hygiene practices are vital for preventing sickness. Essential habits: hand wash with soap for at least 20 seconds. Regular cleaning is necessary for toys and frequently used surfaces. Bathing on a daily basis and keeping nails clipped help minimize bacterial accumulation. It's important to wear clean clothing, especially after engaging in outdoor activity. Fifth one, the significance of childhood vaccination for disease prevention. Vaccines are one of the most effective way to keep your child safe and preventable diseases. Why vaccines matter? Prevent dangerous diseases including measles, mumps, and whooping cough. Contribute to herd immunity, which protects the larger group. Follow your pediatrician vaccination schedule to provide timely protection. Sixth one is effective strategies to prevent childhood ear infection. Ear infection are uncomfortable and might disturb your child's normal routine. Prevention tips: Avoid exposing your youngster to secondhand smoke. Keep your ear dry and clean, particularly after swimming. Breastfeeding reduces the risk of early ear infection in infants. 7th, way to protect children from seasonal allergies. Children's allergy to pollen, dust, or mold can cause substantial suffering. Now, how to manage and prevent allergies? Keep windows closed during peak pollen season. Use air purifiers in your house to decrease allergen. Ensure your youngster shower after outside play to remove pollen. 8. Preventing strep throat in school-aged children. Strep throat can be spread quickly in school, but with adequate precautions, it can be handled effectively. Now, how to prevent strep throats? Avoid sharing utensil for water bottle. Teach children to cover their mouth while coughing or sneezing. If symptom arises, seek medical assistance promptly. 9th, tip for parents to prevent childhood skin infection. Children are susceptible to skin illness such as impetigo and fungal infection. Preventive measures: use mild soap and make sure your child's skin is well moisturized. Avoid allowing toddlers to scratch, bug bite, or worms. Keep cut clean and covered until they heal. 10th, how to prevent pink eye in children. While conjunctivitis or pink eye, it is contagious. It can be avoided with proper cleanliness. How to avoid pink eyes? Teach your youngster not to touch their eye regularly. Regularly disinfect shared things such as toys. Wash your hand properly after coming into contact with an infected individual. 11th, how to prevent stomach flu outbreaks in kids. Stomach flu can cause dehydration. Therefore, prevention is vital. Prevention tips: encourage frequent hand washing, particularly before meals. Sanitize surfaces on a regular basis, particularly during epidemics. If your child is feeling poorly, hydrate them with oral rehydration solution. 12. Safe method to prevent insect bite and related illness in kids. Insect bite can result in allergy and illness. Protection tips: use child-safe insect repellents. Dress children in long sleeve clothing for outdoor activity. Check for ticks after going trekking or playing in grassy places. 13. Step to reduce the risk of ear infection in toddlers. Toddlers are particularly susceptible to ear infection. Effective strategy: bottle feed babies in an upright position to avoid fluid buildup in their ears. Maintain proper nose hygiene during colds. Keep toddlers away from large crowds during flu season. How to protect children from waterborne disease. Waterborne infection can be transmitted by polluted water. Prevention measures: provide only filtered or boiled water for drinking. Teach children not to drink water when swimming. Maintain hygiene in your home's water storage container. How to maintain or minimize respiratory infection in children. Respiratory infections are prevalent, but they can be prevented with the appropriate technique. Proactive tips: use humidifiers to keep the air wet throughout the dry season. Teach youngsters to avoid close contact with people who have symptoms. Keep room well ventilated and promote outside activities. Interactive resources to keep you engaged. Now the conclusion is childhood diseases are an unavoidable part of growing up. But with the proper precautions, you may greatly lessen their frequency and severity. By following these guidelines, you will not only keep your children healthy but also develop lifelong behavior that encourage well-being. Remember that your child healthy is a continuous journey. Stay educated, proactive, and prepared to adjust.